One of the very first questions I had to answer in my doctoral journey was, what business problem did I want to spend the next 5 to 6 years on? As I thought about it, there were two contradicting phenomena that piqued my interest. On one hand, there was an explosion of innovation happening in healthcare. On the other hand, I came across this alarming statistic: 95% of innovators brought to market fail to reach any adequate level of customer acceptance or financial performance. How were we going to reconcile this gap? It was at that moment I decided to invest my time and money in learning what strategies health innovators needed to adopt to successfully commercialize their innovations. Unlike other industries, our quality of life and our very lives depend on getting these innovations through the complexities of the commercialization process and the healthcare ecosystem and into the hands of the people who need them most. In many cases, it could be our loved one's health or even our own at stake. I wake up each morning thinking about how many technologies and advancements health innovators dream up that end up in a zombie graveyard. It's not that their products don't solve real problems or aren't superior to competing solutions. It's because commercializing an innovation is hard, especially in healthcare. If there's a new product idea that could mitigate the healthcare crisis and make our lives better, I'd like to help move those innovations from the zombie realm to the land of the living. Commercializing an innovation in any industry is hard, but it's especially complex in healthcare. Research and experience indicate that even the most promising ideas face an onslaught of commercialization challenges. There are many forces that can kill an innovation: confusing the process of launch and commercialization, overlooking the adoption lens, leading with a technology solution and looking for a problem later, not figuring out who will pay for the innovation up front, being in a multi-sided market and confusing who the user is, who's the buyer, the prescriber, and the influencer, not seeing the patient as a consumer or viewing them only as a consumer, not preparing for the long sales cycle inherent to healthcare, leapfrogging right over strategy and diving right into tactical execution. These are just to name a few. But health innovators are far from hapless and are certainly not helpless. They can indeed control many of these commercialization decisions. There are also many forces that can drive an innovation: understanding the difference between launch and commercialization, developing an early adoption commercialization strategy that includes the 5 key components required for penetrating the early market: timing, targeting, communication, product, and pilot strategies. Using an evidence-based methodology for making commercialization decisions. Getting expert guidance from a healthcare commercialization strategist. Focusing on the early market first, plus many more that you will find in this audiobook.